Good evening, all. I am Sabri Lakshmi, one of the OET aspirants from EduSkills family. I would like to thank Father Salim Joseph and all admin panel members for giving this wonderful opportunity. Reading part B. During exam, we need to complete within 10 minutes these 6 questions. Question number 1. According to the extract, the nursing facilities require more physicians who, answer option A, increase the demand of quality long-term care. B, lead the clinical decision making for patients after care. C, can offer care on site of nursing facility resistance. So, according for the strategy, part A, QAT method. We first read question, answer option, then text. Here, nursing facility care. National-wide nursing facility care is changing to include not only the long-term care, is changing to include not only long-term care of freight resistance, but also complicated and resource intensive post-hospital care. The population of people receiving care in nursing facilities, skilled nursing facilities, and the hospital focus on decreased readmission rates. However, the majority of patients are still long-term stay patients who themselves have increased medical complexity and acuity. Both of these improvements have resulted on increased need for highly trained and committed healthcare practitioners willing to provide care on site to nursing facility resistance. Physician involvement in nursing facilities is essential to the delivery of quality long-term care. Attending physicians should lead the clinical decision making for patients under the care that can provide a high level of knowledge, skill, and experience needed in caring for medically complex population in a climate of high public expectation and strengthened regularity requirement. Please tell question stem keyword.
Is it who?
Require.
Nursing facilities require, then who? Then answer option A, long-term care. Answer option B, for patient after
Patients after care.
Third,
C,
can offer care on site.
nursing facility resistance. So here question stem is asked who. Who means pronoun. Who means pronoun. If answer will be the person, then nursing facilities require. Yeah, facilities means here plural will be used. So this in this case also answer will be in plural form. Okay. Here one more thing. In this paragraph, two contrast word used. First contrast word is but. Second contrast word is however. So according for the strategies, if two contrast word is given, second contrast word after that will be most of answer will be there. So we need to read after the contrast word here. We give important second contrast word. Okay. The majority of patients are still long-term stay patients who themselves have increased in medical complexity and acuity. Both of these imperatives have resulted in increased need for highly trained and committed healthcare practitioners willing move to provide care on site to nursing facility resistance. So, nursing facilities require meaning synonyms of need. Okay. Then
Must.
yeah, must. So here, however, after the contrast word, here mentioning long-term stay patients who themselves have increased medical complexity and acuity, both this imperative, both conclusion. So this both things need increased need for highly trained and committed healthcare practitioners willing to provide care on site to nursing facility resistance. So here, what is mentioning? Nursing facilities require need. So can offer care on site. Offer means provide. So answer option C is here. Correct. How means can offer care on site to nursing facility resistance. So here mentioning healthcare practitioner willing to provide care on site to nursing facility resistance. And one more thing here in topic sentence, if you see nursing facility care is the topic heading of this paragraph. Here nursing facility care is changing to include. not only long-term care of pride, resistance, but also complicated and resource-intense post-hospital. So here, mentioning both things. Both things means here long-term care and post-hospital care. Post-hospital care means patient after care. So here both things here mentioned, but answer option A and B. Answer option A only mention long-term care. B mention only for patient after care. Not mention both things in one answer. So in this way also we eliminated answer option A and B. Then here who means mentioned here first itself I say pronoun person, but here long term care only mentioning about care. Then patient after care, this also mentioning only care, but nursing facility resistance means here only mentioning the person. In this way we are finding this answer. Here one more strategy is also here used, cause and effect. Cause here increased medical complexity and acuity is the cause. So, result effect. Result is an increased need for highly trained and committed healthcare practitioners. So, in this way, this question I find out answer. Everyone understand?
Yes, ma'am.
Here,
Yes.
here
Yes,
five
ma'am.
strategies. First strategy is but contrast word. Please make silent. Here first contrast word, but however. So both contrast were given. Second contrast word will be the answer. Then second one, in topic sentence itself, both mention long-term care, patient after care, and but answer option, go long-term care, patient after care will be separately given. Then plural. Answer option question stem is plural facilities. So answer option also plural. Then cause and effective also. However, here contrast word offer, provide. Nursing facilities means here plural resistance. Nursing facilities is plural resistance. Then recur means need. Who here physicians. Cause and effect. Cause complexity and acuity. Effect increased need for highly trained and community healthcare practitioners.